Assalamualaikum viewers and welcome back to my channel BioDenver's Hub. Today in the playlist of oral and maxillofacial surgery, we will be continuing the same prevention and management of the extraction complications. In that regard, our second video will be about the root displacement. So for example, you are performing any extraction of any tooth. So in which kind of situation there are more chances that the root could be displaced in any of the either spaces or cavities. So we will be studying it in this video. So first of all, root displacement most commonly in the maxillary molars and in the mandibular molar occur. In case of the maxillary molar, the more chances are that it displaces into the maxillary sinus, and the tooth that displaces most commonly its roots into the maxillary sinus is the palatal root of the maxillary first molar, because due to the degree of the divergence of the palatal root of the maxillary first molar, there are increased chances of the fracture, and also that root is also very near to the sinus wall. After that, the maxillary molars, their roots can also be displaced into the infratemporal space, and in that regard, the most commonly tooth will be the impacted third molar. The roots of impacted third molar, there are more chances that they will get displaced into the infratemporal space. After that, we have the mandibular molars, and the roots of the mandibular molars, they can be most probably displaced during the extraction into the submandibular space. So now let us discuss the maxillary molar first. The root displacement of maxillary molars, for example, in the first case, it is of the maxillary sinus. So we will be studying the cause, that due to which reason the root, there are high chances that root will get displaced into the maxillary sinus. So basically, if you are using a straight elevator to remove a fractured root of the maxillary molar, and then in that case you are applying increased apical pressure with that straight elevator, so there are more chances that you will push the root into the maxillary sinus because it is very close to the maxillary sinus. Now we will be studying the management of root displacement. So first of all, we need to do assessment of the three, that is the root, the tooth and the sinus. And after doing the assessment, we will be deciding our treatment and management for that case. First of all, the root, in order to assess the root, you need to assess the size, the position of the root, whether the entire root or just a root tip has been displaced into the sinus. After that, you need to assess the tooth as well. Any infection of the tooth is present or not, or any infection of the periapical tissue is present or not. After that, most importantly, you need to assess the sinus as well. And it must be assessed the precondition of the sinus, that whether it was healthy or it was chronically infected. So these were the important assessment criteria. After you have done the assessment, now we will be studying different cases. So first case could be that if the root that has been displaced, it is very small in size, 2 to 3 centimeter, and it is a root tip that has been displaced. The tooth and the sinus, they have no pre-existing infection. So in that case, what will be your management? So we will first obtain a radiograph to document the position and size of the displaced root. After that, we will be irrigating it through the small opening in the socket apex, and then we will be suctioning out all of that irrigating solution. And due to the suctioning out, there are high chances that root tip could be suctioned out. So you need to check it out. If not removed due to the suctioning of the irrigating solution, the small non-infected root tip can be left in place. So patient, you need to inform the patient, and you need to keep the patient on the follow up for the regular monitoring of the root and the sinus as well. So this was the first case when the root tip was displaced and it was very small, 2 to 3 centimeter. After that, you must be seeing for any kind of oroantral communication that has been resulted in case of this displacement that has been occurred into the maxillary sinus. So if there is any presence of the oroantral communication, you need to manage it by making a figure of 8 suture over the socket, and after that you will advise the patient to take the sinus precautions. And after that, you need to prescribe the antibiotics as well to prevent the infection. And the nasal spray should be advised to the patient to keep the ostium open, and it will decrease the chances of infection as well. Most likely, it is a common occurring that it will fibrosed into the sinus membrane with no subsequent problem. We will be studying the management of oroantral communication and fistula in detail in a separate video, in which we will be discussing the sinus precautions as well. So after that, we have the second case. In the second case, for example, now the root fragment that has been displaced into the sinus, it is quite large. An entire tooth has been displaced, and in that case, after the assessment, the tooth root was also infected, and the sinus, its condition was that chronic sinusitis was present. So in that regard, patient has to be referred to oral and maxillofacial surgeon for removal of that displaced tooth through the Caldwell Luke procedure. I hope this video will be helpful for you all. Don't forget to subscribe to my channel and also hit on the bell icon so you will get notified about our future videos and updates.